Hello mommies, my name is Buhle Khumalo. I am an independent midwife, founder and owner of Mommy Bear Women and Baby Clinic. So today I'm going to be talking to you about high-risk pregnancy. What is a high-risk pregnancy? What are the checklists that we look for to say that your pregnancy is high risk, low risk, or intermediate risk? So not all women can actually have a midwife-led birth because their pregnancy is considered to be high risk. So there's the factors that we look at. Firstly, we look at your obstetric history. What is an obstetric history? Obstetric history is your previous pregnancies. So with your previous pregnancies, with your last pregnancy, did you have a baby that was a stillborn, or did you have a baby that passed away after birth? So within the first 30 days of it, right? Number two, what we look at is has mommy had any previous miscarriages? You considered high risk if you've had 3 or more miscarriages, regardless of when the miscarriages happened in your pregnancy and why the miscarriages happened, but 3 or more miscarriages is considered high risk. You considered high risk if you've had a last baby that weighs less than 2.5 kgs or over 4.5 kgs. That's also a high-risk pregnancy. We also look at if mommy with any of your pregnancies, have you been admitted to hospital, or did you have a pregnancy of high blood pressure or preeclampsia? That pregnancy, it means your current pregnancy is high risk because of that obstetric history. We also look at, has mommy had any previous cesarean sections? So cesarean section means that with the last or any of your babies, you didn't deliver them naturally, but you actually had to have a C-section done. That also makes your current pregnancy high risk. With the current pregnancy, we look at, are you being diagnosed? Are you carrying 1 baby, 2 babies, 3 babies, or even 4 babies? So if you're carrying 1 baby, it's a low risk, but 2 and above, your pregnancy is considered a high risk pregnancy. Your age. If you're under the age of 16, your pregnancy is considered high risk, or above the age of 37. Especially if above the age of 35, it's your first pregnancy, it's a high risk. Your RH factor, we speak about blood type. So regardless of your blood type, if your blood type negative with antibodies in this current pregnancies, it makes this pregnancy a high risk pregnancy. Any vaginal bleeding. So you're bleeding, you need to wear a pad, you're constantly bleeding. You've been bleeding since you found out you're pregnant, you're currently bleeding when you come to the doctor's or the midwife's room, you considered a high-risk pregnancy. Pelvic mass, you won't be able to diagnose pelvic mass yourself, but your healthcare provider will be able to diagnose pelvic masses. That's considered a high-risk pregnancy. When you come for your booking visits, your blood pressure gets taken. So when we take your blood pressure, if your blood pressure, the top one, which is your systolic blood pressure, is above 140, the bottom one, the diastolic, is above 90, that's also considered a high-risk pregnancy because you're at risk of preeclampsia, or if mommy is a known hypertensive patient. So before you fell pregnant, you were taking medication for high blood pressure, your pregnancy is considered high-risk pregnancy. Now we're moving on to general medical condition. We're looking at your past medical history. Are you currently diabetic? Have you had diabetes before, whether it's type 1 or type 2? Have you previously had gestational diabetes? So with your previous pregnancies, you were treated for diabetic, or you were diabetic during that pregnancy, but you're currently not diabetic, but because of that, it's a high risk. Do you have any cardiac or heart condition or heart diseases? Renal diseases, your kidney failures, etc. Are you currently epileptic? Whether you're on treatment or not on treatment, you were epileptic 5 years ago, you're no longer taking treatment for the fact that you were once epileptic, it's a high risk. Asthma, whether on medication or not on medication, it's a high risk pregnancy. TB, currently diagnosed with TB and on treatment, it considers your current pregnancy high risk. Substances, is mommy taking substances, whether you are drinking alcohol, taking drugs, over-the-counter medication, pain medication, any known substances, and you're abusing those substances, then that's considered a high-risk pregnancy. Any other severe medical condition, you can be suffering from iron levels that all the time your iron levels are sitting at 8 and that's a normal for you, then that is considered a high-risk pregnancy. So even if you think your chronic condition is irrelevant to your pregnancy, you would have to tell your healthcare provider that I'm taking treatment for this condition, or I was once diagnosed with this condition and undergone treatment. So in order to say your pregnancy is high risk, there's a checklist that we do, and if it's low risk, there's a checklist that is done. I hope you go through it, and it's not a one-size-fits-all for everyone. You need to be assessed by your healthcare provider, and they are the ones that can only tell you that your current pregnancy is high risk, low risk, or intermediate risk. But remember, you can start off as a low risk pregnancy, but then during your pregnancy, it can change into a high risk.